Welcome to another episode of Question of the Day. Hi, Dr. Dell.
Hello.
So, a woman with a known history of iron deficiency anemia was recently diagnosed with hypothyroidism. Despite being on levothyroxine therapy for the past 4 weeks, she continues to experience persistent symptoms of hypothyroidism. What is the most likely explanation for her ongoing symptoms?
Okay, so if I get the question right, hypothyroid woman on levothyroxine, known iron deficiency anemia, probably on iron supplements for the iron deficiency anemia, started treatment on levothyroxine and is coming with persistent symptoms of hypothyroidism. All right, so levothyroxine is a drug of choice when it comes to hypothyroidism to replace the low levels of the thyroid hormone, that's T3, T4. Now, this woman is also iron deficient. Definitely will be on iron replacement therapy, which has iron. So, taking levothyroxine and iron supplement, meaning that there's going to be a formation of an insoluble complex between the levothyroxine and the iron, which would impair absorption in the gut. And if levothyroxine is not absorbed in the gut into the blood circulation, then what will happen is that its effects will not be realized. Hence, the woman will still remain hypothyroid and be exhibiting hypothyroidism symptoms. It is not only levothyroxine that will form complexes with certain ions. So aside levothyroxine, you can also think of fluoroquinolones, tetracyclines, bisphosphonates, and also penicillamines. So you can remember using the mnemonic LFT lead. The chemical formula of lead is Pb, plumbum. So LFT lead. L will stand for levothyroxine. The F will stand for the fluoroquinolones. That's ciprofloxacin, ofloxacin, moxifloxacin. Those are examples. The T would stand for tetracyclines. You are looking at doxycycline, tetracycline. The B, that would be for the bisphosphonate. We are talking about zolendronate, pamidronate, and the rest. Then the P will be penicillamine. Okay. So anytime a patient is on any of these medications, you have to always find out whether patient is taking any supplements, and these supplements should not, contain ions like what? Calcium, iron, magnesium, and aluminium. So to remember that, you can use CIMA, C-I-M-A. C for calcium, I for iron, M for magnesium, and A for aluminium. So any of the drugs that I mentioned earlier, that is going to be from LFT lead. Anytime they interact with any of these ions, they will form an insoluble complex, which will not be absorbed in the gut. And once the drug is not absorbed, its effect will not be realized. So that is the reason why this hypothyroid woman is still exhibiting persistent symptoms of hypothyroidism.
Wow, very educative. We meet again. Bye for now.